If you're trying to follow federal vaccine policy, protect your neck from the whiplash. Robert F. Kennedy Jr.'s newly appointed vaccine committee is making changes by the day. They want to limit the COVID vaccine, recommending it only for folks over the age of 65. They also want to stop giving kids a combo shot, combining measles and chickenpox protection. But Colorado expected this would happen. They even passed a law just in case they need a little buffer from the feds. Spencer Soicher explains.
Maybe didn't quite understand what was going on.
Dysfunction and chaos have taken over federal vaccine policy.
And this isn't hard. This isn't hard. We have experts, and he's fired them.
On Friday, anti-vaccine enthusiast Health Secretary Robert F. Kennedy Jr.'s Federal Vaccine Committee recommended that only people over 65 have access to the COVID vaccine. That vote after the panel voted to not allow a federal vaccine program to cover the cost of the MMRV vaccine that protects against measles, mumps, and chickenpox.
There's no new science. You know, there's nothing new in these decisions. They're just arbitrarily making these decisions.
Democrat State Senator Kyle Mullica is a legislator. He's also an emergency room nurse. He's the co-sponsor of a new law that some say is an effort to RFK-proof the state's schools, at least to an extent.
I don't know if it's to RFK-proof Colorado. I think it's to protect Colorado from dysfunction.
The law allows the state health board to consider other scientific sources than the federal government when setting the school vaccine schedule.
You know, we saw the writing on the wall that we needed to do all that we could here in Colorado.
While the state health board can look elsewhere for guidance, Colorado is still not immune to the chaos. Just because the state may take guidance from other sources, the law doesn't guarantee insurance companies will cover the shots.
We have our work cut out for us not only from a cost perspective, we have our work cut out for us from the fact that parents are going to be getting mixed signals.
Mullica says he plans to bring a bill next session that involves the insurance component of this. He believes that now that the law on the vaccine guidance is in place, it lays the foundation for the conversation about insurance.
And every time we've been covering these vaccine issues, it's not just a policy thing in D.C., Spencer. It's like the reality of whether a doctor's office is going to stock this stuff or if a pharmacy even is offering it to people, right?
Yeah, we've heard that from so many people. Oh, you said we can get it now, and then we can't. And I talked to CVS today, who says they believe most insurances are going to cover the COVID vaccine and that they have it in all their stores. And then we hear from people at whether it's a King Soopers, a Walgreens, a CVS, hey, they don't have it, or hey, they don't have this year's strain. What do we do?
I heard the same from doctors' offices that we use as well, whether they even have it in stock. All right, Spencer, thank you.